Good afternoon. Students, please be seated. I am Jessica Price, BSN Program Director and Assistant Professor in the School of Nursing. It is my pleasure to welcome you to King University School of Nursing's annual White Coat Ceremony. We are blessed with your presence today as we celebrate these students' formal entry into the profession of nursing. We were honored to be selected to receive a grant from the Arnold P. Gold Foundation to start the White Coat Ceremony tradition at King. We are excited to continue this symbolic cloaking of students, representing a commitment to upholding the patient-centered principles of professional nursing. Students will be cloaked in the traditional fashion, and each student will receive a commemorative pin from the Arnold P. Gold Foundation. This pin represents your White Coat Ceremony and the oath you have taken here this afternoon. You are asked to wear this pin on your white coat as a visible reminder to always demonstrate compassion and excellence in your practice of nursing. I offer congratulations to you, our students, as you take this official first step on your journey to becoming a professional nurse. Thank you to all faculty members, family members, and friends of these students for joining us today, both in person and remotely. Now I have the pleasure of introducing Dr. Donna Frazier, Dean of the School of Nursing. Dr. Frazier has been a nurse for over 25 years. She earned her BSN and MSN degrees from King University and her DNP in Executive Leadership from Union University. She feels it a privilege to serve in the program that was so influential in her own nursing career. Please help me welcome Dr. Donna Frazier.
Thank you. Good afternoon. Students, it is our hope that after the ceremony, you will forever look upon your white coat as symbolic contract for professionalism, empathy, and compassion in your practice of nursing. May you always uphold the values of the nursing profession. You may have already discovered that a small card has been placed in the pocket of your white coat. This card is a message of congratulations from one of the faculty members. As faculty, we are honored to guide and support you on your journey to becoming a professional nurse. I would like to acknowledge all the School of Nursing faculty members who are here with us this afternoon. Faculty, please rise and be recognized. Thank you. I would also like to take a moment to recognize some special guests. Mr. Al Boyes is providing the guitar music for us today. Mr. Drew Snap is assisting with our technology and remote streaming. And Miss Britt Helton is our photographer for today's event. Please join me in thanking them for their service to us today.
It is my pleasure to introduce our keynote speaker for today's ceremony. Please join me in welcoming King University's Provost and Chief Academic Officer, Dr. Matt Roberts.
Well, good afternoon. How are you all today? I told them, I said, be sure in the introduction to say something about how enthusiastic I am about the School of Nursing. And I'm enthusiastic, but I'm doing so with restraint. I'll keep my comments to 40 to 45 minutes this afternoon. What is a white coat ceremony? I had the privilege of being raised in a family that had plenty of nurses, and so this was a concept that was somewhat familiar to me, but I love the ceremony at King because the white coat ceremony signifies your commitment to the principles of nursing that we hold dear at King. It signifies that moment when you go from just the didactic studies to introducing the clinical components and practice of nursing. So let's talk a moment about these professional pillars that you hear so much about, right? You heard these from day one, probably in your first day of orientation for School of Nursing, and there's 6 of them, so please remember there's a quiz at the end before you get your pin. Those are integrity, commitment, service, accountability, civility, and compassion. And in addition to these professional pillars, the other crucial piece, of course, is the knowledge attainment that you gain here and that you gain and retain from your nursing coursework, but also the other coursework that you undertake here at King. Today in this white coat ceremony, we celebrate and we recognize your understanding of the didactic, that is, the academic and classroom instruction portion of your nursing studies, but how now that didactic piece will be held in application in your clinical practice. Let's return a moment to the professional pillars, compassion and commitment specifically. White coat ceremonies across the nation often focus on both the compassion and commitment aspect of nursing. You all know that you have made a huge commitment. First of all, just the celebration and the congratulations that's afforded to you to get here to this spot today. But recognizing formally that when you put on that white coat, it's not just about the knowledge that you get in your head, but how do you treat others? Specifically, how do you treat your patients? Compassion for your patients, commitment to the kind of care that you'll provide that patient, knowing that the person is not just a person in a room on your assigned floor, but your commitment to and treating them as a whole human being with dignity, and in doing your due diligence and taking care of them. Commitment to the integrity required to be competent and to be an objective nurse in your assessment and treatment of patients. And I don't see how the calling of the profession of nursing can be sustained, quite honestly, unless you possess both the qualities of commitment and compassion. I want to share with you briefly one of my own recent experiences. You know, we've recently coming through the COVID pandemic. Certainly COVID is still with us, but it's moving from that pandemic to endemic. Still can be very serious for many people. But during the grips of the pandemic, before the vaccines were available, I had a family experience. My sister, who is a nurse practitioner herself, contracted COVID and was literally hours or days away from being placed on a ventilator. So I rushed to North Carolina. Sorry if I get a little emotional. But it was a very surreal experience because I'm also acutely aware that there's people around us today, students, faculty, that had loved ones that did not make it through COVID. And so we remember them. But I remember acutely the care that my sister received from the COVID ward and how it concentrates the mind that when you have to suit up in those protective pieces. I still remember the COVID nurse that was sort of assigned to me to get me ready. Her name was Ashley. I still remember this. Mission Hospital, great hospital in Asheville, North Carolina. My sister was literally days away from being on a ventilator. Luckily, she made a full recovery. But to see the kind of care and the compassion and the commitment that these nurses provided to see her care through, it just absolutely blew me away. Nursing is a calling. And we need nurses, and our country knows that we do. I hope that you know that nurses are the most trusted profession for 21 consecutive years in the Gallup annual poll of the most honest and ethical profession polls. I'm sure politicians are a close second. But that says something about nursing, though. For 21 consecutive years, the folks in this country who took this poll recognized nursing to be among the most honest and ethical professions. Store that away, okay? We saw the absolute strain and the weight placed squarely on the shoulders of nurses. The videos seared still into my brain of watching nurses recording these videos. You've seen these on social media of how our own nation and our hospital systems were crippled with this pandemic. And the need for nurses today is great, and that will continue to grow. So with all of the responsibilities and things that you must take upon yourself, also know you're entering a profession of which the need is great and will continue to grow. The RN workforce alone is expected to grow to 3.3 million in the year 2031. And that's an increase of almost 250,000 just registered nurses. Now, let's talk about some real encouraging things. This is where I get enthusiastic, so just bear with me. We're so proud of the School of Nursing, the faculty that are here. To be quite honest, when I took this role as Chief Academic Officer 10 years ago, our nursing program was struggling. We failed to have consistent NCLEX scores. I stood before the Tennessee Board of Nursing. I had hair then. But now I stand before you to say that King School of Nursing and their graduates have had 7 consecutive years in passing in the state of Tennessee, which in the union has the highest threshold of first test takers in NCLEX. And while other schools are faltering around us and they're trying to find their grips, and we hope that they do, even when we had COVID, we got back to business responsibly. But we got back, we didn't phone it in, and I think that's been a direct result. But it's also been our dedicated faculty, making sure they develop the curriculum that's relevant, that stays on top of more of the clinical scenario-based judgment that we see in the NCLEX test. And so I'm so proud to see that King is only one of 2 schools in East Tennessee that has had that sort of track record. And so we're going to place a little bit of that burden on you to do this. I know you can do it because our spring cohort graduation had a 100% pass rate the first go around. And I expect the same from you all as well. So we thank you for the excellence in the faculty, but also the quality of students and the commitment that's required to pass these licensure and regulatory pieces. I'm also really excited what's happening in nursing simulation for the School of Nursing. You're going to see some construction and renovation in Whitehall in the skills lab. It's actually going to have to go offline at the end of September because we're getting 10 new simulation mannequins, 7 new hospital beds, including ICU beds, and all the accoutrements that go with that. Also some new flooring and paint. So this is going to allow us to provide you more clinical-based scenario exercises and other subspecialties of nursing that we've never been able to offer at King. So I'm very excited about that. And the opportunities just continue to grow for our nursing education here at King. So let me leave you with a quote. Sort of concentrate your mind, you know, with much responsibility that you have, it's often you can feel the weight of what's before you. And I told this quote to our faculty at the beginning of this academic year in a workshop. And it's going to sound like of 2 minds because I expect our faculty to be reflective practitioners, always improve what they're doing in their teaching. And you know that's expected of you in your clinical practice to be a reflective practitioner. How do you improve? How do you build upon the mistakes? But at the same time, I want you to hear what this quote is saying. Okay, because there's going to be days where you're getting up early for your clinical rotations. You will ask yourself, is it worth it? Do I have the commitment to required? Can I move on from my mistakes? So let's listen to the words of Ralph Waldo Emerson. On days where you flub something up, okay? And that's me every day. Finish every day and be done with it. You have done what you could. Some blunders and absurdities no doubt crept in. Forget them as fast as you can. Tomorrow is a new day. You shall begin it well and serenely, and with too high a spirit to be encumbered with your old nonsense. When I speak to chief nursing officers in the region, and by the way, we've identified at least 7 chief nursing officers in the region that hold a King pedigree and degree like you soon will. And they talk about the holistic piece of not just having the knowledge attainment and the mastery of the coursework that's required, but your ability to communicate with patients, with colleagues, with families in distressed times in their lives. And so even think about the courses you take in religion or in writing and how these all help you to be not just a better nurse, but a better human. Congratulations. And I hope to see you in just a short while across the stage to hand you that diploma. God bless.
As we welcome each of our students into the nursing program, each new student will be cloaked by the Dean of the School of Nursing, Dr. Donna Frazier, and BSN Program Director, Jessica Price. Yeah, I'm looking. As they give me the card. So at this time, I invite the students to please come forward and be recognized and draped with your white coat. Peggy Biggs. Leah Lucas. Chloe Grace Lyons. Samuel Montgomery. Lacey Necessary. Gabriela Huerta. Chandler Raleigh. Madison Robeson.
And now Laura Dower, School of Nursing professor, will come forward and administer the white coat ceremony oath.
Students, if you could please stand. And if you will say the oath with me that's on the back of your program. I take this oath voluntarily, realization of the responsibility which I am entrusted by the public. As a professional nurse dedicated to providing the highest quality care and services, I solemnly pledge that I will consider the welfare of humanity and relief of suffering my primary concerns. I will act in compassionate and trustworthy manner in all aspects of my care. I will apply my knowledge, experience, and skills to the best of my ability
to assure optimal outcomes for my patients. I will exercise sound professional judgment while abiding by legal and ethical requirements. I will accept the lifelong obligation to improve my professional knowledge and competence. I will promote, advocate for, and strive to protect the health, safety, and rights of the patient. With this pledge, I accept the duties and the responsibilities that embody the nursing profession. Please be seated. At this time, we'll ask Dr. Brian Alderman to come deliver our benediction.
I invite you to stand. And now as you go, may the Lord bless you and strengthen you in the work that you do, work that is ordinary, work that is extraordinary as you serve and heal and care for others. And may the Lord bless your hearts and your minds and your hands when you're anxious and when you are at peace, when you are confident and maybe when you feel humbled. In every situation, may you know the Lord's peace, may you know patience, may you know joy. And may God's grace be known in you as you leave here to care for others. And as we all go to care for others beyond the walls of this chapel, beyond the limits and the boundaries of this community, may we meet and serve and recognize Jesus Christ our Lord. Amen.
This concludes the white coat ceremony. I ask everyone to remain seated until the students have exited the auditorium. Thank you for joining us, and please be seated.